It's Patrick Hutzel from intensivecarehotline.com with another quick tip for families in intensive care. Yesterday, I was on an ethics committee meeting with one of our clients who has their loved one in intensive care. So if any of you have watched my videos over the years, I would have said negative things about an ethics committee, and that still stands. So I said to the client initially not to go on the meeting to begin with, because ethics committees, in my extensive experience, after having worked in intensive care for 25 years in 3 different countries, they're a farce, right? I call them the quote-unquote death committee, and they are hospital employees. There's no third-party oversight. Ethics committees are set up to give the hospitals what they want, under the guise of we do what's quote-unquote in the best interest of a critically ill patient or of a critically ill patient. From my extensive experience after having worked in critical care nursing for nearly 25 years in 3 different countries, where I worked as a nurse manager for over 5 years, where I looked after thousands of critically ill patients and their families in intensive care. And now I'm consulting and advocating. I've been consulting and advocating for families in intensive care here at intensivecarehotline.com since 2013. And I can say without the slightest hint of exaggeration that we have saved many lives with our consulting and advocacy. And you can verify that on our testimonial section and on our podcast section at intensivecarehotline.com. So ethics committees, they're a farce. They're run by hospital employees, which means they're not impartial. There's no third-party oversight. And, it's a euphemism for, well, we want to empty ICU beds as quickly as possible by letting people die, right? Because that's ethics committees say, like many ICU teams say, it's quote unquote in the best interest of a patient to die. Now, my first question here is, where's the urgency in killing someone? Where's the rush? What's the hurry? Right? You have to ask that question. Now, my advice is always not to go to ethics committee meetings. My advice is, if you want to think about going there, get an agenda in writing, a meeting agenda in writing, and make sure you get a list of who's going to be there. Who's going to be there in the meetings? Who are the people? Are they affiliated with the hospital? Are they hospital employees? Where's the objectivity of such a meeting, right? Where's the third-party oversight? And you should bring in your own advocate, which is what I did. I was in that meeting, and I believe I've asked all the right questions for the ethics committee to steer away from wanting to kill a patient and giving the patient and the family options. Now, I'm not saying that sometimes end of life is the best option, right? But that needs to be in agreement with all parties, and the family in this situation simply isn't ready. And yet the ICU wants to push the quote unquote ethics committee. What a nice term for a committee that often wants to move people towards end of life because they say it's quote unquote in their best interest. So when you have a loved one critically ill in intensive care, you have to read between the lines. You have to do your own research, and you can't just go with whatever the ICU wants you to do. Don't let them say jump and you ask how high. You need to do it the other way around. You need to see yourself as a customer of a hospital, as a client of a hospital, and it needs to be patient and family centric, not the other way around. Okay, now it doesn't have to be hospital centric. Now, in this situation, for example, this gentleman has sustained, or the client has sustained, a hypoxic brain injury after cardiac arrest. He's not waking up. And the ICU now says, we should move towards end of life. The family wants a tracheostomy. And the family has not been educated around that a tracheostomy should be done after about 2 weeks in ICU, not after 4 weeks, right? Again, families are misled. ICUs are not being transparent, and then it's much easier for them to sell the families on end of life or palliative care, right? Once again, I am not suggesting that palliative care doesn't have its time and its place if all parties are in agreement, but that needs to be fully transparent. And the first step that needs to happen is offer a tracheostomy and make it transparent when a tracheostomy should be done, right? So Again, families in intensive care don't know what they don't know. They don't know what to look for. They don't know what questions to ask. They don't know their rights, and they don't know how to manage doctors and nurses in intensive care. Also, in this ethics committee meeting yesterday, there would have been around 20 people on this meeting. So, clearly they are trying to outnumber families as well, right? That's why I'm telling you, you shouldn't go there. You have a panel of quote unquote experts that are hospital employees, that are not impartial, that are not objective, right? And you'll be outnumbered. That's why you shouldn't go into those meetings, or you only go if you have agenda items discussed that you are in agreement with and that you're prepared for. No one can force you to go into a meeting. No one, right? So I hope that helps, and I hope that helps, and I hope that answers some of your questions around ethics committees, because we get so many questions for families in intensive care. That's why we created a membership for families of critically ill patients in intensive care. And you can become a member if you go to intensivecarehotline.com, if you click on the membership link, or if you go to intensivecaresupport.org directly. In the membership, you have access to me and my team 24 hours a day in a membership area and via email. And we answer all questions intensive care related. Also, in the membership, you have exclusive access to 21 ebooks and 21 videos that I have personally written and recorded, making sure you make informed decisions, have peace of mind, control, power, and influence, so that you can influence decision-making fast when you have a loved one critically ill in intensive care, making sure your loved one gets best care and treatment. I also do one-on-one consulting and advocacy over the phone, Zoom, Skype, WhatsApp, whichever medium works best for you. And I talk to you and your families directly. I handhold you through this once-in-a-lifetime situation that you can't afford to get wrong. I also talk to doctors and nurses directly, and I ask all the questions that you haven't even considered asking, but must be asked when you have a loved one critically ill in intensive care. I also represent you in family meetings with intensive care teams or in ethics committee meetings, right? We also do medical record reviews in real time, so that you can get a second opinion in real time. We also do medical record reviews after intensive care if you have unanswered questions, if you need closure, or if you are suspecting medical negligence. And all of that you get at intensivecarehotline.com. Call us on one of the numbers on the top of our website, or send us an email to support@intensivecarehotline.com with your questions. And if you like my videos, subscribe to my YouTube channel for regular updates for families in intensive care. Click the like button, click the notification bell, comment below what you want to see next, what questions and insights you have. Share this video with your friends and families. I also do a weekly YouTube live where I answer your questions live on a show, and you will get notifications for the YouTube live if you are a subscriber to my YouTube channel, or if you are a subscriber to our email newsletter at intensivecarehotline.com. Thank you so much for watching. This is Patrick Hutzel from intensivecarehotline.com, and I will talk to you in a few days. Take care for now.